Okay, so we're going to go ahead and get started. Thanks everyone for joining us today for day two of the International Women's Day. And we're going to get started with Mega Desai, who is going to tell us about her startup Do Health. Take it away, Mega.
My name is Mega. I'm really happy to be here and tell everyone a little bit about Do. Do is a healthcare company I started a few years ago, and it's a virtual dermatological platform for people of color. And I'll go into a little bit about where the problem lies, but basically this was just me as a patient trying to find a doctor who could treat my skin. I'm of Indian descent and I have darker skin. And sometimes it was hard to find dermatologists who were familiar with what type of lasers and medicines and even over the counter products that I could use. And that's where my search started. And when I found that it was so hard to find something like that and that there were so many other people like me, that's when I decided to build this. So the problem that I started out with was that there's 50 million dermatology visits every year in the US, and only 8% of those are with patients of color, which is just staggering at how big of a disparity there is. And what that has led to is higher than average fatality rates for people of color with skin cancer. It's led to higher misdiagnosis, mistreatments. Um, and so many other factors that have affected how people of color have their skin treated. And I think a big distinction is the fact that dermatology is sometimes seen as cosmetic, and it not always is. And so these are patients that need to be seen by a dermatologist and should be seen and are not. And that's the problem that we're trying to solve. And as I mentioned, there are a few big reasons why people of color just have generally stayed away from dermatology care. And one of the biggest reasons is inequitable care. There are so many common skin issues that just go unidentified or untreated in people of color because physicians just don't have the training that they should. I think there's a statistic out there that only 4% of pictures in dermatology textbooks are with people of color. And many times those pictures are just to present symptoms of different sexual illnesses. And so there's these inherent biases, even in the education that the physicians that we're going to have. And because of that, there's limited access to dermatologists who are familiar with skin of color. Because there's limited access, a lot of times these diagnoses are done directly by a PCP instead of even referring a patient to a dermatologist, which in general, people of color are less likely to be referred to any specialist. They're more likely to be seen in the ER or by a PCP. So this just adds to the problem of a patient with skin of color not being treated correctly. And the last is high costs. Dermatology is a specialty. Most insurances require for a patient to be referred. So that's going to a doctor twice, paying for a doctor twice. Dermatologists are often less likely to accept Medicare or Medicaid. So it doubles the cost of treatment or makes treatment even impossible to afford. And it creates this disparity for an entire segment of the population that should be receiving the medical care that they need. So our solution is an end-to-end virtual care platform from board certified doctors who specialize in skin of color. And what that means is we have a group of dermatologists who are actively trying and researching to familiarize themselves with different symptoms and the way things appear and different diseases that are more prevalent in the skin of color community. And then they're working towards new research and new medications that can treat them better and afford this population the type of treatment that they need. This is just an example of our product. So we have one app for the physician and one app for the patient. Everything is obviously HIPAA compliant, and what it allows for is the patient to be seen in 24 hours. They create a consultation, give 3 pictures of whatever skin ailment they have, and then they're linked to a dermatologist on our platform who can chat with them and either prescribe something if necessary to their pharmacy or have link them up with a dermatologist who specializes in skin of color in their community. So what we're really trying to get out there is just affordable access that's available all the time. And it's for a flat fee, for a flat rate. We don't take insurance yet. So there's no extravagant hidden costs. It's just this one-time cost, and you're speaking to a dermatologist who understands your skin within 24 hours. And our long-term vision is to create a platform for healthcare for all people of color for other specialties. It's no surprise that people of color have kind of been disfranchised in so many different types of medical specialties, from dermatology to regular pharmacy care to women's health. So we want to create a community of doctors who are there to help people of color as they navigate this. Um, so market size, it's actually quite shocking how much people of color spend not only on dermatology but on skincare. In fact, people of color spend 10 times as much on skincare than any other customer segment. So there's clearly a problem. There's clearly, a lack of education and a lack of awareness on the market to help this segment. And so we really think that this helps patients at least find a way to get there medically, to be able to be linked to a dermatologist who can help them on the medical side. Our business model is, like I said, a flat fee per visit. The average dermatology visit right now in the United States can be closer to $200. We're doing a $59 flat fee for the visit, and we expect to see a patient 1 to 2 times a year. We expect to see 90% of the patients on the app and believe that 5 to 10% will have to be seen in office for something that a physician really needs to see in person. But for the rest of the 90% of the cases, we believe that we can provide effective treatment through the phone, through pictures. There's a few reasons why we're different than any other platform. First of all, there's no virtual platform for people of color. There's really nowhere that even acknowledges any one of the telehealth tools that even acknowledges that there are differences in the dermatology treatments for people of color. And so that I think is a really big key difference in everything we're doing. That's the lens that we're looking at the problem from. That's a lens that we're getting dermatologists on the platform from. And I think that that's one of the biggest things. We've also filed a provisional patent for a AI skin identifying tool, which allows for users who don't necessarily need to be seen by a dermatologist yet to answer a couple of questions. And using machine learning, we're able to direct them to what types of products would be best for their problems on skin of color. And we're trying to aggregate that data and hopefully do something good with that, try to get it out into the hands of companies and beauty professionals and beauty companies, because so much of what is lacking in the beauty world is because skincare, makeup products are not even tested on people of color. So that's a really important thing that we wish to use our data for. And the other thing is just to have a community of support from non-physician skin experts, estheticians, nurses, just other people in the medical field who are familiar with skin of color, who can share their guidance and education on it. Competition-wise, like I said, there's no telehealth platform for people of color. There are a few existing in-person practices and clinics that do support people of color. But again, if you don't live in that area, you wouldn't be able to go to them easily. The same insurance and Medicare or Medicaid problems are also rise there. And there's a couple of societies of doctors who've gotten together and created their own communities and to educate amongst the medical professional field. But there's no real application like this online that helps you find those doctors. Traction wise, spent the last year doing research on what the problem is. I've done so many patient interviews, dermatology interviews, and we started kicking off development on the app late last year. We're launching in May, and we're launching with asynchronous visits with it, which is just visits via text. We are launching with video visits in March. And a lot of this has been made easier by the new telehealth laws because of COVID, that allow for um, the the patient confidentiality, patient telehealth rules being a little tweaked, to make it easier for people to receive treatment during this time. And then a little bit about me. I'm the founder and CEO. I'm a regulatory attorney, and I am doing advisory at a Big Four firm right now. I have a background with some political campaigns, with private firms and government institutions. And our team is, we have 2 engineers who are consulting and then a part-time engineer. And then we're working constantly with different dermatologists and creating a dermatology advisory board to help us as we navigate funding and our release. And with that, I'll hand it back over to you, Marie.
Okay. Well, very good. Thank you for sharing that. If you could go back to the first slide, just in terms of, yeah, okay. So right now you guys don't have revenue yet.
No, we
You're
are,
just launched.
yes, we are launching in May, and we're launching our the first physicians we're starting with will be able to treat patients in California. So we're starting just with
Okay.
asynchronous visits in California.
Okay, got it. That was what I was gonna ask. I was like, so out of all of these people,
Yes.
so how many people do you think you can address in your first year?
So we have on board about 10 dermatologists right now that'll covers almost 12 states. And
Hmm.
we hope to bring each one on board as we start. Just want to, you know, California, Arizona, and New Mexico are the states that we wanted to hit, and Texas, because they have the largest populations of people of color. Um,
Hmm.
and we wanted to start out state by state and trying to address the issues that come up as we go. At this point, we have about 1,000 users who have signed up on our website for more information, which has happened without any marketing or any type of outreach. So we're hoping that going to that list, as well as starting formally marketing on social media, will help us gather more patients as we get through. But we expect to, our goal is to hit 100 users in the first month and then double each month.
Okay, got it. And then in terms of your marketing mix or plan, what are the exact tactics that you guys are
So
thinking
I
about
think,
using first?
yeah, so I think the biggest thing is to try and create a community. And that's what we're trying to do on social media. So
Hmm.
part of my research on this was just going on Facebook and Instagram and Reddit, and I found groups of thousands and thousands of individuals who, specifically on Facebook and Reddit, through I'm a part of 8 groups of, they're just people of color who are asking about skin questions,
Wow.
and there's over 500,000 users in just the groups that I'm in collectively. And people post pictures. Um, they ask what treatments they should use, or what does this look like to you, and that's just because there is so much misunderstanding and misinformation in this world. These are individuals who should be seen by a dermatologist, but they don't feel comfortable enough to go to a dermatologist.
But they're going to Facebook.
So they're going to, and and sometimes that guidance may be correct and sometimes it may not be, but either way, there needs to be a community where all of these people can get together clearly. And so we're hoping to be able to use those avenues and find patients that way, who can come here and kind of feel relieved that they know that their doctor will is familiar with their skin and familiar with what this medicine will do on the skin or what it won't do.
Hmm. Hmm. Yeah, absolutely. Um, Excellent. So in terms of, are you raising money right now? Are you contemplating raising money? Like, what's the
So,
status right now?
so, so
Or have you already raised money or?
well, so up until this point, I have bootstrapped all of this.
Mhm.
As we release, I do want to start raising a pre-seed. just because I think that's the level that we're at right now, pre-revenue.
Yeah.
I think it will help boost us exponentially into releasing, and allow us to move into those other states, as I mentioned earlier to you, quicker.
Hmm.
And so, yes, so we are raising.
And I thought I saw pictures of the app when you were presenting.
Yes.
Let's see what it looks like.
So the first image is the app that the patient's version, and the
Mm-hmm.
second image is the version that the dermatologist
That's
is
the
seeing.
dermatologist sees.
Mhm.
Okay, so they're both working on their phones.
Yeah, so they're both working on their phones. The dermatologist can also access the app through an iPad.
Okay, great. And is the phone app also app? Is it an iPhone app?
Yeah, iPhone and it says Android and
Oh,
um,
and Android. Okay.
yeah. And the third
Uh,
image here is the patient's chart, and the fourth
mhm,
image is the chat. So for this asynchronous version, the patient and the doctor will primarily communicate through this chat.
mhm. And have you heard of a company called Forward?
I have not.
Interesting, because you're exactly like them.
No, no, no.
I mean, not in dermatology, but they don't focus. They're primary care. They're not
Okay.
dermatology.
Yeah, I mean, primary care is another example of an area where people of color are just not treated to the degree that they
Yeah.
should be.
Yeah, they actually do it. They actually do primary care in a very interesting way. They have some gadgetry and some data collection and things like that. But
Okay.
it's under the same premise, which is the medical system doesn't really do primary care very well, which is true,
Mhm. Mhm.
and they do it better, and they do it better. And they have an app exactly like yours. So you should check Forward out.
I'm looking them up. Is it Go Forward?
Yes.
Yeah, okay, yeah, I just looked it up.
And there's a couple other ones as well. I just happen to be very much a patient in this space
Okay.
because I can't stand regular doctors. So
Absolutely.
and I have a bunch of weird things, different things. So one is, I have all kinds of little specialty conditions, but one of them is I have a bunch of skin stuff that I
Mhm.
inherited from my mother. And I'm always, it is terribly difficult to get people to take any of it seriously, right?
Mhm.
And
Mhm.
it's I mean, but in general, healthcare in general, it's hard to get people to take things seriously.
Exactly.
Doctor
And I
people,
think there's also a way of doing it in a culturally sensitive way, um,
right?
especially since because um, because sometimes we haven't had the ability to go to doctors. We may be treating these, a skin disorder the same way our parents or grandparents did, and so I think that a lot of times there needs to be a sensitive way of even approaching those topics. When I initially started doing some research, I found that a lot of dermatologists, everyone kept on coming back to using the words lightening your skin, which I thought was crazy that dermatologists were that's what we were starting with. And I think it's important to recognize that first of all, dermatology is not always cosmetic, and second of all,
Right.
it's not always that's not the main goal of why patients are always going in. And so
Right.
go ahead.
I said right.
Yeah, and so I think that that's something that, you want the medical professional you're going to be cognizant of that, to be culturally aware of that, and I think that that's what makes the group of physicians we have, so great.
Hmm. Yeah, that makes sense. In terms of your future sort of team building, what do you envision in terms of having other team members join you soon? What is kind of the first
Yeah, so
hire or first partner or whatever?
I have a technical co-founder in the wings waiting to join as soon as I can raise funding and she
Hmm.
can leave her role and come over. And from there, we would want to start with her and with a few engineers, and um, and start from there. We have an advisory board right now that we're growing of physicians who are will be formally invited as equity advisors. Um,
Hmm.
right as we start raising. And they have been instrumental in helping me because I'm not a physician. So coming at this from a physician's point of view, exactly what telehealth requirements we need to meet, how the app should function from their perspective. And so that has been someone who that group has been someone who has really helped me, who I will be bringing on as we move forward as well.
Mm-hmm. And what do you think about the legal liability and risk factors? How do
Yeah.
you, have you talked to anyone about that yet?
Yeah, so what makes this platform a little different is all of the physicians that we're bringing on are using their own licenses, their own medical malpractice insurances, their own systems that they currently use for their own clinics right now to use our platform. We are in a way connecting the patient to the doctors on our platform, and while they are on our platform, the doctors are using their licenses to perform this. We will also be getting our own medical malpractice insurance for the company. But we have a very strict policy on making sure that our doctors know that whatever they're doing, if a patient needs to be seen in office, for example, that's the guidance that we give, and we don't charge for that visit. And data and privacy wise, everything is HIPAA compliant. Everything is meets the top standard in terms of protecting data and the patient's profile and charts and pictures and everything that we are taking from them. Um,
Mm-hmm, mm-hmm.
and regarding the telehealth regulations, that's an area where my background has come in handy, where I'm able to make sure that state by state we're following those regulations and making sure that what we collect is taken a certain way, what information we're collecting, what we're doing with it, what the doctor's doing with it, and the process as the doctor goes through the visit. So as I said, in this post-COVID world, these regulations have been slightly lightened, and the
Mm-hmm.
obligations are a lot less, which make it easier for apps like this to come out and help a larger population of people.
Mm-hmm, mm-hmm. And so you have all your policies written, all your,
Yes. So we
yeah.
have our terms of conditions. We have everything. We have a privacy notice. Everything is already written, and everything is will be available on our website right when the app launches, so that patients can go on there and see exactly what we're doing with everything.
Mm-hmm, mm-hmm. And you have all your CCPA removal requests and
Yes, we have
all this.
everything.
And you're a lawyer, so
Yeah, and we're also
I was just thinking when I was like, she's a lawyer.
we're also using, there's so many the pipes of the app are we're using so many third-party APIs and things that are allowing us to
Mm-hmm, mm-hmm.
use all of those. So yes, we have all of that covered, which is something that has taken a long time, and we finally have gotten all that down before launching.
Mm-hmm. Awesome. Um, and then the last thing is in terms of um, how much you're looking to raise in your pre-seed, how much are you looking to raise overall?
So to get us through launching and getting us through the first few states, I estimate that we need 250,000, and that's what I am looking to raise for the pre-seed.
Mm-hmm.
And again, I'm looking to work with investors who understand like that this is a real problem, because I think that has been one of my biggest hurdles, is talking to investors who are like, well, is there really an issue? Are people of color really not people of color really not going to a dermatologist, or really do they
I
want to?
really love those questions.
Yeah, and it's very clear that they obviously are not going, and should be. Everyone should be, and everyone should be getting the same medical care. Um,
Right.
and so I think that that's one thing that's important to me. But 250,000 will get us through that first initial hike of those states, and help us move from asynchronous care to synchronous care in video visits.
Mm-hmm. Mm-hmm. Yeah, that makes sense. Okay, well, awesome. Well, thank you so much. It's
Thank you for
really
having me.
great job. And we'll be getting in touch with you about sort of the next steps for your pitch.
Okay.
We have about 6 or 7 groups that have pitched so far. So
Okay. Thank you so much.
you're welcome.